Did you know that despite its popularity and numerous health benefits, garlic is not suitable for everyone? In this video, we'll cover 8 common side effects of garlic and why you should avoid it if you have certain health issues or are taking certain medications. By the end of this video, you'll have a clear understanding of when you should consume garlic to reap its health benefits and when it's best to choose alternative products. We will also offer some solutions as well as discuss the proper dosage in some cases. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like and let's get started. There are many natural ways to stay healthy by properly utilizing an abundance of foods. Garlic is known for its many health benefits. It can be used to stabilize blood sugar levels, especially in diabetics. It helps to regulate and lower blood pressure, prevent cardiovascular diseases, heart problems, and stroke due to blood clots. It is a powerful antioxidant, as well as an antifungal and antibacterial agent. The list can be continued ad infinitum. Those who consume it regularly can enjoy all its amazing effects. But there are some obvious side effects as well as dangers, which we will talk about today. So, who should avoid garlic and why? This may sound strange to you, but believe it or not, some people should stay away from garlic, especially highly concentrated garlic supplements. Number 1. Gastrosophageal reflux disease. Some people with GERD, gastroesophageal reflux disease, commonly known as reflux disease, should avoid garlic because it can trigger symptoms such as heartburn and acid reflux. In some cases, those who experience discomfort or worsening symptoms after consuming garlic should avoid it or consume it in small amounts. The form in which garlic is consumed can also affect its effect on GERD symptoms. Raw garlic, garlic powder, and garlic supplements may be more likely to cause GERD symptoms than cooked or processed garlic. Cooking garlic can help reduce its potency and minimize its ability to aggravate acid reflux. Individual intolerance to garlic can vary greatly, and some people may find that they can consume small amounts of garlic without being adversely affected by GERD symptoms. Number 2. People taking blood-thinning medications should also be careful with garlic. While blood thinning is usually a positive for many people with obesity, diabetes, and other conditions, garlic also has blood-thinning properties that can interfere with the effectiveness of blood-thinning medications such as warfarin, aspirin, or other anticoagulants. Consuming garlic along with these medications may increase your risk of bleeding or bruising. If you are taking blood-thinning medications and notice that you bruise easily, you should limit or eliminate garlic consumption for a period of time to monitor the changes. Number 3. People with digestive problems should also pay attention to their garlic consumption. This is the second most common reason why people avoid garlic, because it is high in fructose and sulfur, as a result of which people can suffer from diarrhea, abdominal bloating, and gas, especially if consumed on an empty stomach. One quick solution to this problem is to eat it with meals and possibly after a snack. Avoid taking garlic supplements in the morning. Remember, always listen to your body and consult your doctor if you have any concerns or experience negative effects from garlic consumption. It's important to find what works best for your individual needs. Number 4. People with certain medical conditions, such as low blood pressure or hypoglycemia, low blood sugar, should use caution when consuming garlic. Garlic has been reported to have a hypotensive effect, meaning it can lower blood pressure. This effect is attributed to the presence of compounds such as allicin, which help relax blood vessels and promote vasodilation. While garlic's hypotensive effect can be beneficial for people with hypertension or high blood pressure, it can pose a risk to those with already low blood pressure, especially if consumed in large amounts or in concentrated forms like in garlic supplements. It can lead to dizziness and even fainting. People with hypoglycemia should be careful when consuming garlic as it can further lower blood sugar levels and lead to symptoms such as weakness, confusion, sweating, shivering, or fainting. Number 5. Patients with certain autoimmune diseases. We're starting to realize how common autoimmune diseases are these days. A lot of people get diagnosed and they start this uphill battle. Some studies show that garlic can stimulate the immune system, potentially worsening symptoms in people with autoimmune diseases such as rheumatoid arthritis, lupus, or multiple sclerosis. Such people may want to consult with their physician before consuming garlic on a regular basis. Number 6. Persons with sulfur intolerance, garlic contains sulfur compounds that can cause adverse reactions in people with sulfur intolerance or sensitivity. Symptoms may include gastrointestinal discomfort, headaches, or skin reactions. Those who experience these reactions after consuming garlic may want to avoid it. Number 7. In people with kidney stones, garlic contains oxalates, naturally occurring compounds found in many plant foods. Oxalates are known to bind to calcium in the body to form calcium oxalate, a major component of kidney stones. Although garlic is not among the foods that contain the highest amounts of oxalates, it does contribute to dietary intake of oxalates, especially if consumed in significant amounts or in concentrated forms such as garlic supplements. People with a history of kidney stones, especially those prone to calcium oxalate stone formation, may need to moderate their intake of high oxalate foods, such as garlic, to reduce the risk of stone formation. Number 8. Another category of people who should avoid garlic, but only if you've noticed these problems that we're about to talk about, are nursing mothers. Did you know that garlic can sometimes change the flavor of breast milk? This can lead to fussiness or refusal to feed in some infants. While moderate garlic consumption is generally considered safe during breastfeeding, if you notice your baby refusing to drink your milk, you may want to abstain from garlic for a while. Now let's talk about the ideal daily dose of garlic. I have an important message for everyone that I learned while experimenting with garlic and garlic supplements. There is no way garlic supplements can be as powerful and beneficial as fresh garlic. So, if you don't fall into any of the previously mentioned categories and want to use garlic to reap all of its amazing benefits, here's what you need to do. First of all, never eat garlic on an empty stomach. Also, do not exceed the ideal daily dose, which is 1 to 2 cloves per day. Keep in mind that cooked garlic loses a lot of its beneficial properties and compounds such as allicin and antioxidants. I know that when cooking, it can sometimes be difficult to calculate how much garlic you will use. So, as a general rule of thumb, stick to 1 to 2 cloves per person you are cooking for. Garlic isn't the only seemingly healthy food that some people should avoid. Be sure to check out our videos on other foods and who should avoid it and why. If you have any questions or have anything to say, feel free to post a comment. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.